enroll in the Part B part section of that, and the open enrollment for that is between October 15th and December 7th for this year, so you might want to look into that. Okay, so we got traditional Medicare, right? Part A, then Part B. Oh, about the work credits. You should be getting quarterly statements from your Social Security Administration with the statement saying how many credits you have. I know I started working when I was 16, and not too long after that, I got my first statement. I was like, whoa, what is this? What is this? So you can look at your statement, and if you're not getting the statement, it's okay. I put the Social Security phone number there, so you can call them and ask them, questions. How many credits do I have, or what do I need? How can I qualify? Can I use my spouse's record to qualify? And they'll give you a list what you need. And they're pretty available. They're available from 7 a.m. to 7 p.m. So you should be able to catch them there. You might have to wait a long time. Don't call in on Monday, because I've been on hold forever. Okay. So we got traditional Medicare, right, or original Medicare, Part A and Part B. Now it's where it starts to get complicated, which is Part C. They also like to call it the MA plans, or it's the Medicare Advantage plans, and then we have your supplemental Medicare plans. So when it comes to this, to make it not so confusing, I like to think of this as like a restaurant. So over here you got your Medicare supplemental plans, and over here your Medicare Advantage plans. So medical supplemental plan, I like to think of that like a buffet. You go in there, you pay up front, and then you eat whatever you want, and you take it because you already paid that one fee. So supplemental plans, the cheapest I've heard is about $120 a month. So keep in mind that with the supplemental medical plan, you have to pay a monthly premium. So let's say about $120. So whether you go to a doctor 1 time, 2 times, whatever you have to do, whatever lab work, whatever blood work, whatever, you don't pay anymore because you already paid that $120 or whatever it is, depends on where you live. You already pay that amount, so you don't have to pay again. Now with the Medicare Advantage plan, you have to pay, let's say, $10 copay for every visit that you go see the doctor. So it really, what preferences, so if you want your mashed potatoes, your turkey, your gravy, you have $10, $10, $10. So if you're that type of person that doesn't mind digging into your pocket, writing a checkbook, or paying up front every time you go to the doctor, maybe a Medicare Advantage plan is good for you. But if you're like the other person that it's okay paying that amount and then just going, then a supplemental plan is good for you. You also got to take into account what your income is. Like for example, my mom, she usually goes to the doctor like twice a year. She doesn't really go to the doctor. So if she had the Medicare supplemental plan, how much is she really paying for those 2 visits? About $1,400 a year, especially if you're in an SSI of like $800–900 nowadays. Maybe Medicare supplemental plan is not right for you. So I say my mom should be in a Medicare Advantage plan because $1,400 for 2 doctor visits is better. She has $10 copay here, $10 copay there. Yeah. So like for my stepdad, for example, he likes to travel around the country, right? Medicare supplemental plans are good nationwide. So you don't have to belong to a network of doctors. So it doesn't matter what state he's in, he can go and be seen. It's more like a PPO. And then another thing for him is he goes to the doctor a lot. And I heard this, that hurts, this hurts. He's always at the doctor. Yeah. So he forgets his checkbook, he forgets his wallet, whatever. So it's better for him to have a supplemental Medicare plan because he can just go be seen every time and he doesn't have to pay every time because you already pay that amount. Whereas a Medicare Advantage plan, you pay, and then you sign up for your Part D, your prescription coverage, which is around $30 nowadays. Yeah, so we got those 2 down, right? Yay! Okay, Part D is your drug prescription plan, okay, or your drug prescription benefit. That one can get a little bit tricky, and there's this thing called a donut hole that everyone's just like, oh, what is that? So the cheapest I heard for a Part D Medicare, it's about $30 a month, right? And you can shop around and see what's best for you, and it is also by zip codes like every other health plan out there. So basically what it is you pay your monthly premium, which is, let's say, is like your premium, which is like $30 a month. And then besides that, remember, you gotta pay your co-insurance, your co-payment, and your deductible. So $30, your deductible is about $310 a month. So You pay your deductible, so whenever you go get prescription, if you know you're gonna be using a lot of prescription, because I don't have to tell you, you guys know prescription can get really expensive fast. So I recommend that you sign up for a Plan D, Part D plan. Also, because if you don't sign up, they'll give you a 7-month period, and that 7-month period to sign up starts 3 months before you turn 65. So within that 7-month period, you have to sign up. And if you don't sign up, you will have a penalty, and they will charge it, and it will keep accruing every month. So it's better just to select something and sign up. Anyway, so basically the $310 deductible, you start paying. That's like right off your pocket, right off the bat, right away. Every time you go get a prescription, you pay. Every time you pay, you pay it until you hit that $310 deductible. After you hit the $310 deductible, Medi-care will pay 25% of your prescription until you hit $2,830. So Medi-care, you'll pay 25%, Medi-care will pay 75%. Now here's where it gets tricky, and is that donut hole. When you hit between that gap between $2,830 to $4,550, that's the donut hole where you got no coverage. That's scary because you got zero, nada, zilch. You got no coverage in that area. Now so you pay everything from your pocket. Now after the 40 between that period and after you get your $4,550 and over, then that's where you have coverage again. And they like to call it the catastrophic zone because now you've met all that you needed and now you've got coverage again. Does that make sense? I'm making it a little confusing. So I put some different examples of monthly costs for different Plan D programs that are around our zip code in the area for Antelope Valley, for Lancaster and Palmdale at the bottom. Another thing to keep in mind is some of the experiences that I had at the daycare with some of the seniors that I helped is that there's all these health plans out there and they just come and sign up seniors for whatever, just tell them sign here, sign there, without explaining what they are. And then they get into this Medicare Advantage plan and they don't even like it and they can't even see a doctor. Like the last experience I had was a senior who had his podiatrist, his doctor, and his optometrist for like 10 years. And they had a really close relationship and he really liked his doctors. But somebody came along and signed him up for a Medicare Advantage plan without even knowing. They just told him, you get free hearing aids, you get a test, you get vision plan, you get dental plan, all excited about all these great things. So they signed him up, and then he went to his doctor's appointment. They turned him back when he showed his Medicare because he didn't have original or traditional Medicare anymore because he was signed up with the Medicare Advantage plan. So keep in mind that if you sign up with the Medicare Advantage plan, then you have to go to those specific doctors. That's why it's called managed care. You no longer have the freedom to choose what you want because these are programs that are provided by private companies. So the federal government gives these programs a specific amount of money a month to provide you for care and services. So they are in charge of your care. They're called managed care. So they'll decide whether you need that chemotherapy or whether you need XYZ services. So you gotta make sure that you know what you're getting into when you sign up for this plan because you might not be able to see your doctor that you were always seeing. So then this particular individual, he was really confused and overwhelmed because he couldn't see his podiatrist, he couldn't see his optometrist, he couldn't see his doctor because they signed him up for that Medicare Advantage plan. So what we have to do is we have to go through all these loopholes, calling, and they had to send him an application to disenroll. You have to wait another month. Meanwhile, he can't see his doctors. So you got to make sure that the doctors you're going to be seeing when you enroll for that Medicare Advantage plans are in the network and that you know who those doctors are going to be that are in the network. If you don't like those doctors, then maybe don't sign up for the Medicare Advantage plan. But they don't tell you that you can only see that providers within the network. So make sure that you know that so you don't have to go through that experience. Now for people that have Medi-cal and Medi-care, you can have your Medi-care with a health plan and you can have straight Medi-cal. And vice versa. You can have your Medi-cal with a health plan and you can have traditional Medicare. That's fine. Now if you choose to elect a health plan for each, for Medi-cal and for Medi-care, also a health plan, make sure that they work together, that they're partners, because otherwise they will just disenroll you for one or the other, and then you'll be asking, what's going on? I can't see this doctor, I can't see that doctor, I can't get the services, I can't get that services, because they have to work together. So make sure that, when you're signing up for any Advantage health plan or supplemental plan, or with your Medicare or Medi-cal, that you ask, well, if I sign up with this Advantage health plan, can I still use my Medi-cal with this health plan? Because otherwise they'll just disenroll you. Another thing that's going on around right now that I've seen is a lot of the seniors that have Medi-cal, that have straight Medi-cal, which is not enrolled with the health plan, are getting this letter from LA County saying that by May 1st, they have to enroll their Medi-cal with a health plan. And if they don't do it, the Medi-cal will just choose for them. That's not good. So make sure that if you already got this letter, or if you're going to get this letter, that you keep your eyes open for the mail for further instructions, because they'll be sending you instructions on what plans and how to enroll. Otherwise, they'll choose one for you, and then you'll be caught in that whole dilemma of, who do I go see? What happens? So it's better if you decide what services you want and which doctors you want to see. Now, some of the good things about, I know it sounds so bad, right? No, but some of the good things about having these two programs is that some of them provide fitness classes. Like, I'm a certified personal trainer by the National Academy of Sports Medicine, and I used to work at 24-Hour Fitness in Lancaster Sports Club. I actually witnessed and saw one of the classes that they provide for Medi-care participants is called Silver Sneakers, and it's all for seniors, and it's great. So, and that's one of the pluses to having a Medicare Advantage plan, because some of these Medicare Advantage plans, they provide these individualized classes and programs to help seniors be fit and have a great social life and have a wonderful time. So the Silver Sneakers class, if you want to find out if your plan is eligible, they offer it. I have a number here and I can give you later. But it's offered at the All About Fitness and 24-Hour Fitness. And basically it's an award-winning program, and they offer conditioning classes, exercise equipment, pool, sauna. The classes are designed for older adults who want to improve their strength, flexibility, balance, and endurance. So it's a really cool class. They give you like light weights, and they have chairs, and it's a lot of occupational therapy and flexibility stuff. We do some of those things at our daycare if you're interested. Another advantage to the Medicare Advantage health plan programs is they have, I know Aetna has a case management service. Well, they have a manager and a doctor help you with your needs. They also have like a weight loss program where they have an individual coach that helps you and keeps you on track if that's what you want to do, you want to lose weight. So these are just some of the advantages. They have a women's health reminder, an annual preventive reminder, and a hypertension program. So they have a lot of little perks out there with this Medicare Advantage programs to help you, if that's what you're looking for. So it's really a preference, what you like, what you need, what services you require. So you make a decision based on that. So just make sure you do your homework and find out, what you're looking to get out of this. And if you want to keep your doctors, if you want to explore other doctors within their network. I know I've been talking a lot and you're probably all confused and there's so much information flying around. I try to put all of this together into one page, and I could have kept going, and I know I made the print very small, but there is just so much out there, and I thought, this could be like really fun stuff, like highlights that you can guide yourselves in case you just kind of need to make a decision on something. But anyway, so if you guys have more questions, this is like a learning process because things are always changing, and I always get like new things coming to me because I work with seniors every day. So they always bring all these issues to me, and I try to help them resolve it. So I have to talk to these insurance companies. So it's always something new that's coming along. Oh, there's a new letter going out there, so I know who is going to be affected and what's going to happen. And they're probably going to lose coverage, so I try to help them. We call Social Security, we call Medi-care, we call whoever we need to call to help them get what they want and what they need, and to try to get them off these plans that are making their life miserable. So if you guys need help, or you need more information, I put a stack of my business cards here, and this is just some flyers information about our daycare program. And I brought this along because I know you guys like to be healthy and fit. But we're going to have a booth here, or a vendor at, it'll be at Lake LA. It's kind of far away, but looks like fun. It's like a nice breakfast, and they're gonna. Our clinic is